Hi, my name's Katy Holmes and I'm the CEO of the British Chamber of Commerce, Dubai. This is our podcast for you. Don't do that, do this. We're looking at success stories across the region for companies that are already established here and those looking to come to the UAE. On today's episode, we have Leah Cotterill. She is the CEO of Cigna Healthcare for the Middle East and Africa. We are talking healthcare insurance, the role of the employer, the accountability of the employee, vitality, health insurance, travel insurance, all sorts of really important topics to help you have the best life here in the UAE. So please listen in, enjoy the episode, and also subscribe on our YouTube platform and all other podcasts so that you get everything as soon as possible. So enjoy the episode. Thank you.
This podcast wouldn't have been possible without the following teams. Rightfully for storytelling and thought leadership, Studio Red for the quality podcast studio and video production, and Sherbet Lemon for branding, social media design and editing.
Leah, thank you so much for joining us on
Pleasure.
the Don't Do That, Do This podcast. As an annual strategic partner of the British Chamber of Commerce, I would like to think that I have a lot of knowledge already, but this is why we're doing these podcasts so that the rest of the membership and our followers understand exactly what your proposition is. So thank you for joining us.
Pleasure.
I do have some structure questions, but I know that this will flow. There'll be lots of information. So I thought we'd scene set first, if that's okay. And I'd love you to tell us and those listening, what's been your journey? What's your UAE experience to date?
Gosh, yeah. So I arrived in 2008, just before global financial crisis, which I think ironically was probably a great time to arrive. So much going on here in the region, particularly from a healthcare perspective, and kind of haven't looked back since. I took the decision to come to Dubai really after 10 years of working in the UK. I was loving what I was doing, and I decided that, you know what, there was something more, there was something missing, and I didn't know what it was. And I was talking to recruiting companies and they were saying, you could do this or go and work for a competitor. And I'm like, there was something missing. And then somebody said to me one day, they're like, what about Dubai? I'm like, it just wasn't in my, sphere of thought, I guess. So me and my mum came on a little weekend and I had a couple of interviews, including with Cigna. And I came back with a couple of job offers and decided that Cigna was the right opportunity. And while it was in the same industry, I was working for what was AXA PPP Healthcare in the UK at that time. It was the same industry. The opportunity to sort of bring that, understanding of health insurance and that expertise and then apply it to a completely different market was pretty exciting. So the story goes that I was the third employee of Cigna here locally.
Gosh.
At that time, we were fronting through a local insurance company. So strictly speaking, I was actually employed by them, but I was the third Cigna person. I actually ended up marrying the second Cigna employee, and the first Cigna employee married the fourth Cigna employee.
Oh my goodness!
So
keeping it in the family.
Yes. So it was definitely an interesting time. But yeah, so I mean, now we have over 1,000 colleagues here in the UAE and more across the region as well. So that was a pretty exciting journey. I did leave for a few years. I think it's also part of the journey, isn't it? I think to realize what you're potentially missing out on. So I began full transparency after about 5 years. It was 2013. I started to worry a little bit that maybe I was losing the ability to go and work in a more mature market again. Because things are different, right? Things can be a little bit more transactional, a little bit rougher and readier. And I was getting a little bit worried about that. And at the same time, a old boss of mine had moved to the US and offered me a role over there. So I went off to the US with my then fiance, who wasn't working for Cigna at that point. He'd already moved on, and spent 2013 to 2017 in the US, just outside Philadelphia, working for our global headquarters business, which is in Delaware. So if anyone's familiar, Dubai to Delaware is quite a transition. But it was really fun, and I loved that US experience. We fully planned on staying, actually. We bought a house. In fact, we built a house. Both my boys were born there. But there was something. We used to watch the Desert Classic on TV, and there was just like a little heartstring pulling.
Calling you back.
Yeah. And then at that time, Cigna was just starting to look at a license here. And I was on maternity leave with my second kid. And I started getting pulled into meetings. And that's quite unusual, right? Cigna's very good at, respecting space and personal circumstance and all that sort of thing. In the end, I actually ended up taking my 3-month-old to Glasgow for a meeting. I phoned my mum and I'm like, I have got a great opportunity for you. I flew her up to Glasgow. She sat in the hotel with the 3-month-old while I ran up and down the street going to meetings and coming back to feed him and stuff like that.
This wasn't in the middle of winter by any chance.
This was December, yeah.
Oh my gosh.
Yeah, this was chilly.
Yeah.
But the point being that was the beginning of coming back, right? That was the project, the acquisition project. And I just knew that as a family, it was a great place to be. And then I think, honestly, from a work opportunity perspective, there's a certain mindset about people here that I absolutely love, right? That can do. I think Dubai's own, I don't know if you've ever been in Emirates Towers, there's the shop, right? Which is selling a lot of Dubai merchandise, which is impossible is possible. I love that. And so that was 2017 and been back ever since.
And that's, congratulations on that. But being very modest, that you've left a trail of people that have respected what you've been able to do to then bring you back as well. So how important is your network in terms of your career, but also having ears to the ground as well?
Yeah, I don't think you can underestimate network, right? I think network in business, but network and relationships here as in the UAE, the Middle East, is a very relationship oriented place. And health insurance is a very small little industry as well. So we tend to find that everybody knows one another. But I think it's thank you. And it's a really fair point that, yes, that was about keeping connected. That was about also putting your hand up and saying, you know what, I'll do it. I want to be back. That was also about joining the calls when I was in the US at 6 a.m. and 7 a.m. in the morning to keep connected and to maintain that relevance. So I think network relationships, let's face it, you performing, right? You networks and relationships are great, but if as an employee, you've got to be bringing value. So what I really value now today about my journey is having worked in UK, in Europe, in the Middle East, in Africa, in the US. I do truly feel like I can sort of step back and put different people's hats on from a perspective, which I think then allows you to build relationships with other people, right? Because people want to know that you understand what's important to them. So I think network, relationships, but also it's not easy to move around the world, particularly with a family, but putting yourself out there a little bit and immersing yourself into different businesses, different business units, and different segments of the population from a work perspective is critical.
And you must have seen huge shifts in the healthcare insurance industry generally, but what has been the sort of seismic shifts since 2008 in terms of the proposition and the offering and also the client expectations?
Yeah. So I think there is no question that the biggest shift from a health insurance perspective that's taking place in this region is regulatory, and that's around the mandatory insurance. So when I arrived here in 2008, Abu Dhabi was in the process of rolling out its mandatory health insurance. So that was part of expanding the market, and quite frankly was part of the research that I did to say this is actually a good place to be. So Abu Dhabi did that in 2008. Dubai followed in 2014, and actually Northern Emirates followed in January of 2025, right? So and meanwhile Saudi did theirs, and there's ongoing conversations in Oman and Bahrain, Qatar, and even Kuwait as well. So this is the, I guess, the sort of demand side shift that was really critical to advancing healthcare, I think, in the region, because with health insurance, which, let's face it, is funding, right? With funding of of healthcare services, then the healthcare providers come to the market to meet that supply, whether that be GPs, clinics, and all the more sort of like specialist services. So I think that was the critical point that means that the majority, or arguably all, of the population now have access at least to the most basic level of services, which is obviously socially a very, very positive thing. I think there have been shifts along the way culturally, in terms of, I love the fact that we can sit down and we sit down with many other, mutual friends of ours, and we talk about mental health, right? And we talk about menopause, and we talk about well-being, and we talk about prevention in a way that 17, 18 years ago, 10 years ago even, we weren't doing. So I think that there is, as an already diverse place has continued to diversify, then we've got more inputs like that, and we're having lots more great conversations about those type of conditions. We've also seen, heck, we tend to just forget about it, right? But 5 years ago, we were locked down in a global pandemic. And I think that experience that we all went through has shaped some of our awareness and possibly improved our awareness of access to healthcare. Maybe we appreciate it a little bit more.
Could there be a double-edged sword there? Because something that we talk about in the healthcare working group with the British Chamber of Commerce, which Cigna is obviously a part of that, is this concept of the worried well. I think the expression, I heard that first through Mediclinic Parkview's GM, so to give him the credit of that, but how the car parks were full of people that were just coming into the hospital for something that, well, certainly in the UK and the NHS, you wouldn't have the time or even the patience to find somebody to diagnose you. Is there kind of from COVID, but also is there a bit of a phenomenon around being an expat without the expat? You don't have your community around you to say, oh, you're fine, you don't need to go. Is there anything around that? And is there like a sweet spot for the healthcare professionals finding us all, hypochondriacs without anybody to tell us to wind our necks in?
Have a cup of tea.
Yeah, exactly.
I think it's a huge topic, and I think it comes from very, very many places. I think it comes from the fact that everybody who is here, well, I mean, there's 190 odd nationalities here. That's 190 different expectations and experiences of their own healthcare system, right? We come from the UK. We typically are pretty stoic. We know that we can't get an appointment with our GP. And so we tend to suck it up for a few days. You've got people coming from the subcontinent who have had no access to healthcare. And in having no access to healthcare, then maybe they really do need healthcare. And so you're bringing quite a lot of legacy illnesses, hereditary conditions, congenital conditions, that sort of thing. And then, sorry, but you've got the Americans who are quite used to having their cards to flash around. And so you tend to see the utilization of that population being a lot higher. But they're also really, really good at doing things like getting their dental checkups, getting their annual medical, and all those sorts of things, because they are more familiar with a private healthcare system.
And that's the kind of preventative healthcare space.
That's right, which is really important, because we'd much rather spend money on prevention than spend money on, something catastrophic, right? So I think that it comes from lots and lots of different backgrounds coming together, with different expectations and different experiences of how to access healthcare. Then I think on top of that, then you've got a lack of understanding of how this healthcare system works, right? What you can do, what you can't do, where you should go. And then it tends to become word of mouth, as opposed to proper referrals. There is no real gatekeeping here, right? In the UK, you would go to your GP would either sort you out or refer you on. Here, you can phone up and book an appointment with a cardiologist.
And have a second opinion within the same day.
Exactly.
It's quite incredible, isn't it?
Which on one hand really is incredible, right? I do agree with you. I think that there is a tendency to sort of focus on the wastage and the cost and everything, and that's all extremely true, and we need to tackle that. But on the other hand, you know what? There's very few other places in the world I would rather be in terms of accessing care, because you can get access to care. So I think you've got this demographic diversity, you've got this lack of understanding of the local healthcare system. And I also think you have a lack of skin in the game. Now, this might be a little bit controversial, so
zoning in.
Apologies. Only you and lots of people out there. And a podcast for perpetuity, right? But there is little skin in the game. One of the really positive things about our mandatory health insurance is that it makes sure that everyone's got access to something. When you think about populations that perhaps earn a little bit more, there is scope for them to be able to contribute more to the costs. Example, if you go to a doctor, your maximum liability for your consultation is going to be 100 dirhams, right? That's what, 3 coffees? Is it enough to help inform choice as a little bit of a stick? So in the US, for example, when I was there, I had a $7,000 deductible. So the first $7,000 of care that I received in any one year was on me.
Right.
Just informs your choice, right? I've got a sore throat. Okay. Am I hydrated? Have I tried honey and lemon? Have I gone to bed and had a good sleep? Or do I go to the emergency room because there's no doctors available at 11 o'clock at night? It's just that sort of like pragmatic stuff. And at the moment, I feel that the doors are very far open and the awareness levels are low, and the consequence of doing it is very low. And so what's to stop it? So I think going back to your point about that sort of, that wastage thing, me at Leah and also Cigna, we don't want to stop people making claims. Let me be very clear, right? We don't. But we want to encourage people to spend money on value, right? On things that are really, needed, and also prevention.
Yeah. So what role has the employer, who is your client, for that of, large corporates, multinationals, and small firms and solopreneurs, just to check that's the full scale of the proposition for Cigna Healthcare. So what role is, I think it sits kind of probably at HR. Is there a responsibility within the HR department to inform and obviously making sure that there is utilization of the policy, but also not overutilization. Have you got any examples of what good looks like within an organization?
Yeah. So it's critical, right? A partnership is absolutely critical. I personally see that we have a huge responsibility, right? As an insurance company. And again, not from a please don't make a claim perspective, but how can we help you maintain a healthy lifestyle and a healthy outlook, and why that's important for an employer, whether you're a solopreneur or a large corporate, is that's about productivity. Right? You and I were talking earlier on about going to the dentist, right? That's time out of our day. That's lost productivity. So, it's if you extrapolate that across an entire workforce, or us having to take our kids to the doctor, those sorts of things, it has that impact. So I think number one, understanding that there is a connection between health and productivity, and productivity and performance is super important, and that has to come top down from an organization, right? This is not just health insurance should not just be a tick box exercise, right? What's the cheapest I can get? What's in budget? And I get it, right? I run a company too. We have to hit our targets and manage our budgets, but it's not a good place to scrimp, because things will come back and bite you. So communication's key. I think having a really good partnership with your insurance client manager, with your broker if you have one, and really promoting awareness, right? And that includes what's in your table of benefits, what's in your exclusions, right? So what to expect, but also really, really importantly, how to navigate the healthcare system. So what to expect, what questions to ask, making sure that, if you walk away with that bag of goodies from the pharmacy, do you really need it? When your doctor asks you, oh, do you need some more Panadol for the kids or some more Brufen? No, actually, I'm good. I've already got 3 bottles, or I can go and get that myself, right? I don't need to rely on my insurance to stock up my medicine cupboard. So I think it's a bit about accountability beyond, beyond what I would have to pay for, but thinking about that social accountability as part of my small group plan, even my individual plan. Let's be candid. Insurance premiums are a function of insurance claims, right? And in a large group setting, it's very transparent, right? It's very, very clear. If you claim this one year, broadly speaking, we're going to expect you to claim the same or a little bit more the following year, depending on your population and lots of other boring insurance talk, right? But broadly speaking, and equally for individuals and small groups, as a pool, there is a correlation between what you claim and what you pay. So I think socially, as an ecosystem, we all should try and be more aware. We're actually working at the moment on a health insurance literacy campaign. So there's some really interesting stats coming, particularly out of the US, and you'll probably be familiar with a lot of the really sad narrative in the US at the moment, which really highlights this gap between expectation and awareness. So we're sort of, taking that learning and saying, right, okay, what can we do here locally? So insurance talk is often, really complicated and techie and jargony. So we want to make it easy and simple and relevant, right, and relatable, so that people can understand. So we're in the next couple of weeks, and we'd love to share it with BCCD, of course.
Happy to be that channel partner for you.
Wonderful, thank you. We're going to start to share a series of videos, both for our customers, but also we're going to share them more broadly through our social channels, because there's a community benefit that can be had by this. Again, this is totally agnostic of Cigna, right? This is more about how can we help you. The number one question that we get asked: which doctor should I go and see? Which clinic should I go to? So we're really doing a lot of work on that. I won't spoil. Marketing will kill me if I spoil anything. But look out for that because that's really important. And then for employers, obviously, a lot of employers are fantastic, right? Once a renewal's done, we'll go in and we'll talk about it. Our teams are available 24/7. We've got apps, we've got chat, we've got all of these things that customers can use to connect with us. We just need to encourage them to feel like they can. And also, again, one of the challenges we have as an industry, particularly in this part of the world, is the perception that insurance companies just want to not pay. And there are many really, really good insurance companies out there that are happy to pay. And we want to help you do that, use your plan most effectively, because we know that when you get to use your plan benefits most effectively, A, you're healthier, win. B, you're more satisfied, which means longer term relationships, right? Whether it's with an individual or with a large corporate. So there is genuinely a win-win in increasing that awareness for between clients and end customers and insurance companies.
So with just picking up on some of the things that you mentioned then, and it's excuse the pun, but it's a symptom of Dubai, is where everything's quite transient. So people moving jobs, people moving villas, practitioners moving clinics and hospitals. So the term that I see talked about a lot on some of the expat Facebook groups is around pre-existing conditions, which arguably we're all born with pre-existing conditions. And you mentioned menopause before. That's another good example where that's flagged for pre-existing. So if somebody's working in an organization and their health cover is organized through that, then they move or they become a solopreneur and then they're having a new healthcare plan. Are there any, in the nature of do's and don'ts, is there any advice that you can give of them to be aware of what is technically pre-existing, what won't be covered in your new insurance?
Yeah, great question. And again, another one of those high friction points, I think, for people dealing with health insurance. So 2 seconds on why, right?
No, be reasonable.
Yeah, just because it's not just something that we do for fun, right? So in large corporate groups, big groups, there's such a broad spread of risk and the premium pool is quite large that there's no real need to look at specific individual pre-existing conditions, right? We'd look at larger claims, but not pre-existing conditions. So you're probably the most impacted people are going to be on individual plans or as part of small groups, typically up to sort of 10, maybe 20 employees, depending on the insurer. And there, premiums are pooled together, right? So lots of people buy and it's all pooled together so that you can try and get some sort of average, right? Otherwise, your really sick people are going to be paying massive amounts and your really healthy people are going to be paying less and it doesn't work. So what happens there is we look at age and we look at gender and a few other factors. Then the Dubai Health Authority say that you cannot exclude pre-existing conditions. So in many places in the world, in order to manage the underlying risk of a health plan, you would perhaps exclude a medical condition. So if I'm going to keep using the UK as a benchmark, given we are talking from a British angle. In the UK, for example, you might buy a healthcare plan that excludes perhaps you had a cancer diagnosis in the past. But that's okay, actually, because you've got the NHS to fall back on. The biggest issue here is that you don't have a social healthcare system to fall back on. And unless you've been really savvy and kept up with your national insurance payments, then you're potentially exposed, right? So pre-existing conditions are those things often that will determine whether somebody's going to claim a lot of money or not. So insurance companies will ask people to declare their medical history. Some of these forms can be really complicated, quite ambiguous. We know that. In fact, at one point, 3-4 years ago, about 60% of claims on these type of policies were coming through as non-declared, right? So we saw that people either were intentionally not declaring, but more likely didn't understand the question or forgot, right? We tend to put these things behind us, right? So we went back and we simplified what we call our health questionnaire. So the questions are written in plain English. They give examples. And we also work really closely with our broker partners, but also through our insurance experts, sort of sales teams, to work with customers to encourage that transparency. If we know up front what your health status is, we can give you a transparent and honest quote, and that means you're not going to get any nasty surprises. So that would be my greatest tip with the context of why it's important. If you hide something to try and get a lower premium up front, and it's submitted and the insurance company finds out, then they're going to decline the claim, probably quite rightly, right? So it's not easy, but I think people being honest, open, transparent, and then trusting that they'll work with the insurance company. So we have a team of clinicians that work with our with these policies to look at it and say, look, I don't want to overreact, right? Let me give you an example, right? A 50-year-old woman is going to have a baseline price. Well, in that baseline price, which is based on the claims history of all our 50-year-old women, there is an expectation that they're going to be going through menopause. And therefore, there is an inherent loading already in that premium that reflects the nature of the type of care that somebody's going to receive age 50, for example, or 45. So we try to be very open and transparent and realistic about it. And where we need to load, we'll tell people, right? This is what we're going to do, and this is why we're going to do it. And again, that's what I would just encourage. Ask lots of questions. Use a broker to help you do that as well, right? There's some really, really good guys out there that will help guide you through it. And think about these things long term. Don't think about it as a tick box exercise when you get off the plane and you need to get your visa. There's a tendency then to make really short-term decisions. Try to avoid that. So try to plan for that. And think about it as a long-term relationship, because if you buy 1 year from one insurance company and then you decide next year you're going to switch to someone else, they're going to ask you to redeclare your health history.
Yes, that's
if something's happened in that last year, then you're going to pay more than you would if you stuck with the previous insurer, because their pre-existing view is prior to when you started with them. And we see a lot of employees coming off big groups and going out on their own and setting up their own consultancies. And again, a factor of Dubai that I absolutely love. In those situations, there are a couple of options, right? You can either redeclare your medical history. If you're fit and healthy, that will by far be the most cost-effective way of doing it. There are group leaver options that you can take. Typically what will happen then is you'll get slightly lower limits, slightly less comprehensive benefits, because you're getting cover for those pre-existing conditions. So again, talk to your broker, talk to the insurance companies. They'll be able to work through options with you. But I think communication, transparency, and plan ahead, because these things, whilst insurance companies can give you a quote quickly, you need to understand it, right? And make sure that you're making the right decision.
And it was great to have Cigna as part of our UK-based business briefing in March, and delighted that you're partnering with us again for Manchester in June. And that was a strong topic in terms of social responsibility, with 120 people in the room ready to board a plane and come and live in Dubai. It was get your health insurance sorted first. Also with so many new expats, but also the British tourists, there's so many new to the UAE. And previously probably we're used to the E111 form, if it's even called that anymore. So travel insurance is really key as well. And that's just to, I'm familiar with that, but just to express for anyone that doesn't know, is that you aren't covered if you don't have health insurance. You will have a pretty expensive and limited experience here should anything happen. Is there anything you want to add on travel insurance, health
No,
insurance?
I think you're absolutely right, right? You have to make sure that you're protected because to your point, we all see these social media posts and we see some really tragic human situations where you're left exposed. So I think, and again, it depends on where you come from as to what your mindset is, right? I think as a Brit coming from the UK, we've been very used to social healthcare systems. Let's face it, it's the same for us traveling to Europe now, right? E111 doesn't exist in the same way as it did before. So I think just reframing it and really, even when you book your Emirates ticket, right, it offers you health insurance or offers you travel insurance as part of the ticket. I think don't underestimate the value of that because a broken arm, right? Someone falling over and a broken arm or a food poisoning episode. Quickly you'll be spending, 3, 4, £5,000 out of pocket.
Yeah, I've been in waiting rooms in ERs, A&Es, and I've seen tourists literally having to hand over their credit card to get stitches, which you're not going to decline either, and when you're in that need.
Which is, especially for us Brits, is really egregious, right? It's something that we're really, really not used to.
Talking about preventative healthcare, because there's something that as a chamber, we ensured that everybody working in the chamber had an executive health check as part of an employee benefit. And it was a really positive experience. But then cynical me is now thinking, does that mean we all have booklets of pre-existing conditions that could be used against us? And then the other part of that question is, what is our responsibility to follow those things up? Is it on an annual basis? And then should we be, where do we go with those booklets of of our current state of health?
Yeah. And I think that's in a healthcare ecosystem where it sort of lacks accountability from that sort of general practitioner perspective. You can go and find a great general practitioner and you can purposefully build that relationship and that continuity with that person. To your point, there is quite a lot of movement of healthcare professionals around the different clinics, which from a medical records perspective can be quite challenging. One of the things that I would in terms of do is always, and many really good clinics do this, but do ask for copies of your blood test results, scan results, copies of the notes from your medical appointments so that you also have your own medical record as well. Because again, whilst the Ministry of Health and Prevention is trying to bring in single medical records, the reality is it doesn't really exist yet. So I think that take that accountability on yourself. Does that build a history of pre-existing conditions that's going to come and bite you at some point? It shouldn't, unless you actually have a diagnosis, right? Going for a preventive check is not symptomatic, right? Again, look at the questions very carefully on those health declaration forms. It's going to ask you if you've been hospitalized. It's going to ask you if you've been diagnosed. It's going to ask you some very, very specific questions. It's not going to ask you if you've been for your preventive check, right? And that's not a negative. Now, if your preventive check does identify something for which you get diagnosed, then yes, of course, that becomes pre-existing. But at that point, you're just grateful for the fact that you've caught something.
Yeah, absolutely.
That you've caught something early. Patient accountability is key, and that's why awareness is important. And then, sorry to sound boring, but then I come back to my health literacy, right? No one is going to chase you, or everybody's going to chase you, right? I don't know about you, but I receive lots of messages from healthcare clinics who have got my number and tell me and remind me, oh, you need to come for your health check, or oh, we've got a new cosmetic surgeon in town, or come and get your Botox, or whatever. Like, so there's a lot of push marketing that's happening, but it's not necessarily targeted, unless they're telling me I need Botox. is not necessarily targeted, and the outcome is not necessarily aligned with what it is that you're looking for.
You've mentioned productivity a few times, and that is in line with the Dubai 2040 urban plan and vision. So at a Dubai Chamber meeting recently, the DET, so Dubai Economy and Tourism, so they spoke very confidently about, yes, we're building the population, but it's not just about mass, it's about productivity. I've got a question for you. It wasn't on the form, but it's out there.
Yeah.
Do you see ever a future for employers to be hiring based on healthy candidates as part of the recruitment process? Can you imagine that ever being an issue?
I can imagine it
Mm.
because I've experienced it. So in the US, for example, and it comes from more of a health and safety angle, I think, rather than a productivity angle per se. But when you are employed in the US, you're asked to take a urine test, um, and you're asked to declare whether you smoke. The urine test is detecting drug use. So there are already established examples, and this is not just this could be for an office job, right? This is not if you're on an oil rig or something like that, because then you would see them to be that much more intensive. So yeah, I can imagine that. I think obviously there is an incredibly fine line when it comes to how that information is used. And particularly if I think about, hereditary conditions or anything, a disability, for example,
Accident.
those type of
Yeah.
things. Yeah. So I think it has to be very, very carefully managed. And if you look at the UK, but also look at when an individual goes off on an expatriate assignment, like a defined assignment, like old-fashioned expat assignment, you would typically have a pre-assignment questionnaire. And in that questionnaire, you would be asked about your health status, about any medications that you're taking for you, but as well as your family, because what an employer doesn't want to do is send somebody overseas where maybe they can't get their medication. And if they are going, then they can facilitate, longer term prescriptions and all sorts of things. I actually remember years and years and years ago, there was a family that were assigned here to Dubai, and the child had an allergy to the sun.
Oh, wow.
And so, you look at that and you say, well, what are the implications of that from a health perspective for obviously for the child, but then also, thinking about the productivity impact to the family and everything. So I can envisage it to some degree. I think there has to be massive guardrails and guidelines around it. But if you look at it from a health and safety perspective, or even sort of like a moral standards perspective and protecting your workplace, I think there's potentially a place for it.
At one of our events, one of our members was showing me a dashboard on his iPhone that showed the sleeping patterns of his C-suite, and he was moving meetings around depending on whether the CTO had had a good night's sleep. I mean, it's just that next level of transparency again, but it's a fascinating.
I was going to say, and I think this is often the skepticism that individuals will have around, having a wearable, having it connected to a health insurance policy or a life insurance policy, or even your employer. So I think that there is a fair amount of skepticism about that. But I often, when we talk about productivity, I often refer back to corporate culture. And there are certain corporate cultures that can embrace this type of closeness, if you like, between one's work life and personal life and health. But I think it requires a massive investment and a real shift change in the type of behaviors, communication, top down, demonstrating that this is a positive enabler of you and your health in the workplace, that fair game, we expect to have a knock-on impact to the productivity of our organization. But I think I don't know there are really, really scaled examples of where that's been able to be achieved. And we even see it with things like employee assistance programs, right? So almost every one of our policies has an employee assistance program embedded in it. So you would use an employee assistance program completely anonymously to get support for mental health. Heck, even you've had a bad day, right? And I don't know how to juggle all of these things, or I had a conversation with my boss that made me feel really uncomfortable. Help guide me. These solutions are available for many, many people, and yet the utilization is really low. And one of the things, awareness is a big issue, right? So I'm back to my my health literacy. But beyond that, one of the biggest barriers is people feeling uncomfortable that is it really anonymous? Is it going to go back to my employer? And the reality is, it does not go back to your employer. It is completely anonymous, and I would highly encourage people to use it. But
Yeah, people seem to be more trusting of ChatGPT. I've heard lots of examples of people using it as their
Therapist.
psychologist, therapist in between sessions. And then there was something on Dubai Eye recently where somebody was saying actually that the psychologist was saying it's pretty good, especially in a crisis. But yeah, we're so precious about our data and information. But I always say if I needed Wi-Fi, I'd give my email and all sorts of information just to get a
anyone
signal.
just to get connected.
Yeah, so we're very selective. Talking about culture, and I am quite biased, having worked with Cigna and so many of your team over the years and had a really, really positive experience. It feels like you do have that, you take that very, very seriously about the brand and the culture that you'd have. So do you have, I mean, I've seen no movement, everybody sort of staying where they are. What's your strategy for retention and attraction that you think stands out in the market?
Yeah, so I think culture is something that you build over time. Having been with Cigna now for 17 years, there is still, genuine sort of, commonality between that culture that we bought then from the UK here. And then we've built on that, right? As the team has been, we were 3 Brits and an American to begin with. We were like that classic, multinational profile. And now we've got over 40 nationalities in the team, and different generational demographics. It's incredible. So I think for culture, it takes time. We imported, if you like, that global culture, that culture from the US, and then we've needed to adapt it to what it means here, locally. But I think, I would say collegiality, collaboration, care. These are not actually what's written on our
You're going off piste.
on the door, but just the. And actually, I was part of a panel discussion earlier this week with our regional legal and compliance team that had come into town. And I was there with my COO. And they asked us a similar question about culture. And Frida actually reflected on the fact that when I was recruiting her, one of her first questions for me was about culture. And she said, because we'd had a conversation, and I said, look, if there's anything that you want to know, I'm like, ask it, because I'd rather you find out now than, later. And she said, I still have your voice message where you talked about culture. So I'd like to re-listen to that. So,
Yeah.
But I think that about caring colleagues, about communication, about collaboration. I think it's very much about listening as well, and being respectful to each other's perspectives and points of view. We take a very firm line around sort of, behaviors, and making sure that, that we are, well, I think it's about respect, right? But it's not just about core respect, it's about cultural adaptation of respect to different people. So we try and really focus on, adaptability of how we communicate and how we lead as leaders, right? And then that top-down walking the talk.
Mm.
So making sure, and demonstrating that sort of empathetic leadership and a bit of vulnerability, right? We're all humans. It may sit in the corner office, but we're all humans. And I think that makes a huge difference to sort of that relatability. I think it helps that organizationally you're succeeding, growing, being successful. I think that sort of feeds the culture as well.
And it seems to transcend as well through to your customer experience. And I seem to remember that you've recently appointed where somebody has a breast cancer or a cancer diagnosis, they have a caseworker, which I think is fantastic for somebody that's going through that stressful time that doesn't have to keep repeating themselves over and over again. So please showcase that, because I think it's an amazing initiative.
Thank you. So I think this really comes back to having that common mission and purpose, right? We are very clear as an organization that our mission is to improve the health and vitality of those that we serve, as well as the communities that we operate in. And our customer is at the center of everything we do, and that goes back to the culture piece, right? Because in order to support our customers, we need our team to support the customers. So the situation that you're referring to is we have a team of nurse case managers. We have docs and as well, but we have a specific model whereby for certain medical conditions, it could be acute accidents, those sorts of things, or diagnoses, cardiac, cancer, pediatric situations, or all sorts of situations. We assign a customer a nurse case manager, and that nurse case manager will be the patient advocate. And actually, I'm back to health literacy. It really orients around advocacy and awareness, right? So this is a nurse that will partner with the patient and the family. And that's almost as important, right? Because if you've got somebody in a terrible situation in hospital, they may not be that person that you're connecting with. Then you're connecting with the family to make sure they get the support. And it's about checking in, right? It's about checking in on their status. Are they comfortable? Do they have questions? There could be language considerations. There could be cultural considerations. They will also connect with the nursing staff and the clinical staff as well. They'll be overseeing medical reports, checks and balances. We'll be using second opinions behind us to also sense check and make sure that patient is getting the very best. Sometimes we suggest a second opinion, right? And then we can connect them. We can also make sure they're very aware of what benefits they have. So we've had a cancer case recently, actually, where the patient came to me and said that they so valued the support of our nurse case manager because they were making a really, really difficult decision about what their treatment plan was. But for the nurse case manager to be able to say, look, whether you choose this, or this, there will be support for reconstruction if this is your choice. There will be support for checks on, scans every 6 months if you choose this. So just that then opens up the mind to okay, so there are different clinical options, but this is then about a personal choice and knowing what that patient just felt so more able to cope and have those choices, and then they're right there by your side, right? So to your point, if you're having a bad day, then they can be that person to speak to about how they're feeling. So they do quite a lot of that emotional support. And again, if that nurse case manager identifies, what, maybe this person could do with some, specific counseling or support, then they can refer them on as well. So it's not a replacement of the clinical staff. They work in conjunction with the clinical team to make sure that not just the clinical outcomes are optimized, but the experience and the ability to cope with and experience is improved.
That's great. You're giving some control back where they would feel out of control.
Yeah.
And so thinking about from your position as CEO and your career journey to date, and it's not quite the kind of Stephen Bartlett experience of, what would you tell your younger self, but what would you tell anybody that's probably at any stage in their career at the moment? What piece of advice would you give, or multiple advice up to you, that you think would have helped you and you'd like to help somebody else?
Sure. I will start by saying I have been incredibly fortunate throughout my career of having people along the way that have offered feedback, thoughts, insight, guidance, listening and seeking out feedback. Most people are very happy to offer constructive feedback. Sometimes they'll offer it when you don't ask, but go find those people that that you work closely with, and seek out their counsel. Tell them what it is you're looking for them to be really clear. We started with networks, right? You started with the importance of relationships. I don't think you can underestimate that. I've always been quite a sociable person, but that doesn't mean that I find it very easy always. Like, once they get to know somebody, then I love talking to them. You and I can talk for forever. But in a big room with lots and lots of different people there, and I look quite happily just sort of, edge towards the side. Thank you very much. So I think the importance of learning how to network and how to just connect with people, I think that would have been really useful, perhaps a little bit earlier on, and especially in this region where, it's who you know, not what you know, is even more important, right? And then I think that understanding that one size doesn't fit all in terms of your communication approach, your leadership approach, and the adaptability to situation, to circumstance, to culture, and to your stage of career is incredibly important. And I think often you can find a style that works for you and assume then, well, if it's worked in this situation, it will continue to work. And that's not necessarily the case. So I think I hadn't appreciated that perhaps until actually, oddly enough, moving to the US was a really massive eye-opener. And because I was, I was absolutely the minority as a Brit. And you would have thought that there would be very, very close synergy between our sort of, approaches in the workplace and everything. Heck, I've worked for an American company for 5 years, but it was a huge eye-opener in terms of communication style, expectations. I would receive an email which says, "Call me." "I'm sorry? Call me?" I'm like, "How about, hi, Leah, how are you? Hope you're having a great day. When you get 2 minutes, will you give me a call, please?" But there's no negative intent assumed by that. So I think that sort of adaptability and again, back to mindset. I think the things that I would absolutely not challenge is just being really open-minded to saying yes to things. Like, not always expecting an immediate return on doing something, right? Orient your mind and your objectives in the organizational purpose and mission. And if that means you're doing something that's not in your job description, do it, enjoy it, embrace it, network with new people, learn new things. You will be more relevant and relatable in the future. And, you asked me the question of coming back here was probably because I'd left some good perspective of me, right? Actually, I built a brand here. Well, those things don't happen if you've worked toward with a narrow mind. So I think I would absolutely not change that. And I think just that a can-do attitude, right? A solutions orientation. I don't like to say no. I probably should say no a little bit more, actually. But finding a way to do things. I think that sort of mindset has been.
Well, thank you so much. Thanks for sharing your experience and all the amazing things that Cigna Healthcare are doing in the region. Thank you for your time.